Amazon just launched an AI health agent on Amazon.com and the Amazon Shopping app. Not inside a hospital system, not through a health plan portal, but on the same app where you order paper towels. It books appointments, it manages your prescriptions through Amazon Pharmacy, it reads your lab results and explains what they mean. And if you're a Prime member, you get 5 free virtual care visits covering 30 plus conditions from UTIs to erectile dysfunction to anti-aging skincare. 200 million Prime members just got healthcare bundled next to their free shipping. Here's the thing about Amazon and healthcare. They've been building toward this momentum for almost a decade, and most of the industry didn't take it seriously until it was too late to catch up. In 2018, they buy PillPack for $753 million. That gives them a pharmacy license in all 50 states. And by 2020, Amazon Pharmacy launches. In 2023, they close an almost $4 billion acquisition of One Medical, which gives them over 200 physician offices and a primary care brand that doesn't really feel like a clinic. And now in 2026, they wrap all of it, pharmacy, primary care, specialty referrals, through Rush and Cleveland Clinic into a single AI agent sitting on the most used shopping app in America. This isn't a chatbot. Amazon built this on Bedrock. That's a multi-agent architecture. A core agent talking to the patient, sub-agents handling specific workflows like prescriptions and scheduling, auditor agents reviewing conversations in real time, and sentinel agents monitoring the whole system, with escalation paths to human providers built in. That's not a healthcare experiment, that's actually infrastructure. But here's the part that should get the attention of every health system executive watching this. Amazon now owns the full stack, the AI layer, the clinic network, the pharmacy, the delivery logistics, the billing relationship with 200 million households, and the daily habit of opening that app. No health system in America has that. Most health systems are still trying to get patients to download their portal app. And the data says that about 60% of patients who download a hospital app, they use it once and they forget all about it. Amazon doesn't have that problem. Their app is already on your phone. You already trust it with your credit card. The Prime member offer is the wedge. That's 5 free message-based visits covering common conditions. That's worth up to $145. For non-Prime users, it's $29 a visit or $99 a year for One Medical membership. If you're a Prime member, that's half the normal price. I could be wrong about this, but I think the pricing strategy is more important than the AI. The AI is impressive, but the pricing is what shifts behavior. When the marginal cost of asking a healthcare question drops to zero for 200 million people, the volume of healthcare interactions that start on Amazon is going to be enormous. And that changes who controls the front door. So what does this mean if you actually run a health system? First, about primary care referrals. Amazon is now a referring provider. They partnered with Rush University and Cleveland Clinic for specialty care access. If your system isn't in network, you're not getting any of those referrals. And those referrals are going to come with data. Amazon will know what the patient needs before they walk through the door. And that's probably leverage. Second, the prescription flow. Every prescription renewal that routes through Amazon Pharmacy is one that doesn't go through your outpatient pharmacy. Hospital pharmacy revenue is already under pressure, and this probably accelerates it. Third, and this is the sleeper issue, Amazon now has a longitudinal health record for anyone who uses this. Lab results, prescription history, visit notes, self-reported symptoms, all integrated with purchase data and behavioral health signals. No health system has that kind of multidimensional patient profile, and Amazon is building it passively every time someone asks their AI healthcare question. The question isn't whether Amazon's AI is as good as your physician's. It doesn't need to be. It just needs to be convenient enough that patients go there first, and your system becomes a referral destination rather than the starting point. Here's what to watch over the next 12 months. Watch the employer channel. Amazon already sells healthcare to its own 1.5 million employees. If they package this AI plus One Medical plus pharmacy as an employer benefit product, that's going to compete directly with health system-owned health plans and narrow health system networks that many systems really depend on. Watch the data play. Amazon built this on Bedrock. That's their own AI infrastructure. Every interaction trains a system, and at scale, they'll have more real-world health conversation data than any academic medical center. What they do with that data and whether regulators let them actually keep it will define the next chapter. And watch patient behavior. I think this is a real important one. If people start asking Amazon health questions the way they ask Alexa for the weather, that is casually, frequently, without thinking of it as actually healthcare, then the relationship between patients and traditional providers changed fundamentally. Not because the technology replaced anyone, it's because the habit has shifted. Healthcare's front door has always been the doctor's office or the emergency room. Amazon just made a credible case that it's an app you actually already have on your phone. The $3.9 billion question isn't whether the AI works. It's whether your health system has a plan for when patients stop coming to you first. Full sources and deep dives are on my Substack, links in the description, and until next time, I'll see you then.